Okay, today we're looking at the lower extremity. First off, we're just going to start by observation. Looking for any skin lesions, discolorations in the foot, in the leg, toes, anything abnormal to that effect. Then going to check for any trophic changes like wrinkling, edema, anything that would bring concern to that, any bruising or anything like that. Next we check just temperature, so to do that, just take the dorsum of the hand. For that, just go along and feel for any changes in temperature, anything abnormal in that sense. We're then going to look at the toenails, just to make sure that they're all even, not asymmetrical. So I'm going to press down on the toenail and then watch for normal flushing of blood just rushing back in. It's a little hard to tell on hers because she has her toenails painted, but that's alright. All looks normal. Next we're going to palpate pulses. First, we're going to start with the dorsal pulse. So for this one is on the dorsal pedis. It's going to be just right. You can move your foot back a little bit. Yeah. Straight back. Just feel just having two fingers just slightly placed. Feeling for dorsum. I can feel that on her foot. Next, I'm going to check for the pulse that's right behind her tibialis, which is going to be on the behind the medial malleolus, and just checking that pulse for any abnormalities, feeling that it just has good texture, amplitude, everything of that effect. Next thing we're going to check is the popliteal pulse. For that, I'm going to have you bend your leg just at 9 degrees, and I'm just going to give you a heads up. I'm going to put light pressure on the back of your knee, and just feel the popliteal pulse, which also feels good. The next thing I'm going to check is her femoral pulse. For that, I'm just going to give you a heads up. You can cover your genitals with your hand if it makes you feel more comfortable. Otherwise, if she's fine with it, then just give her a heads up that you're going to be feeling in between. For her, it's going to be in between her ASIS and her inguinal ligament. So I just find her femoral pulse in between and feel that. And then good pulse, nothing wrong with that also. Next thing I'm going to do is test for pitting edema. So for that, I'm going to start off down at the toe and foot. I'm going to press on the back of her foot and just make sure that the skin just kind of snaps back and has no lasting pitting with that. I'm also going to check the bottom of her foot for this. And then I'm also going to press down on her shin just to see if there's any pitting edema. Next thing I'm going to do is just observe again the ankles again, which I've already did, but you palpate for any edema, swelling, anything abnormal of that sort. If there's nothing abnormal, we then head up to the inguinal ligament again. For this, I'm going to palpate the lymph nodes at the inguinal ligament. The lymph nodes are just right above and below, so I'm just going to give you a heads up that if you want to cover up your genital area, I'm going to be palpating just above and right below the inguinal ligament for lymph nodes, and just to test out, see everything's all right. And everything seems to check out just fine. Next thing I'm going to do is just do femoral auscultation. For that, I just need to use my stethoscope, and I'll be using the bell of the stethoscope just to check for any abnormal bruit or swishing. Now, it's not abnormal to hear the pulse just because of how big the femoral artery is, but you may, what we're listening for is just any abnormal sounds of blood rushing through. So I'm just going to place this right on your femoral artery. It's going to might be a little bit cold. And everything sounds normal. There was no abnormal bruit or swishy noises that would make me feel that something is wrong in that area. Also, when we were looking at the inguinal ligament, we'd be checking for herniations. To do that, once again, I'm going to be palpating your the ligament just to make sure there's no swelling, anything abnormal. Ask if there's any pain with that. And that feels all normal to me. Next thing I'm going to do is check Hohmann's sign. For that, I'm going to raise the patient's leg about 35 degrees. I'm then going to dorsiflex her foot and then squeeze her calf and ask if that hurts at all?
Nope.
No pain with that? Good. This would be checking for unilateral swelling or anything of that nature. Next thing I'm going to do is have her do leg innervation test. So for this, I'm going to hold her legs up at 60 degrees and I'm going to hold it for about a minute. And then I'm going to have her stand up and just observe her feet to make sure that there's no abnormal blood flow going on down at the feet. So for that, I'm just going to raise her legs, hold them up at about 60 degrees, over 60 degrees, and have her wiggle her toes. So normally you do this for 60 seconds. I would then ask her, have you stand up for me? And then just observe her feet to make sure that there's no abnormal blood rushing or no blood rushing to the feet after this. Next thing I'm going to do is I'm going to do a venous tap. So for this, I'm going to have her still standing up. I'm going to palpate behind the leg and then in front of the knee. And I'm just going to do light tapping and just feeling for anything abnormal, any blood clogging or anything of that sort. And that is it.